felt that Portugal, it's a nice balance between Africa, Asia, and North Europe and most developed countries. In a way that in some developing countries, as we have in Africa or in Asia, people are more connected to each other. People touch, people are more warm in the relation, which is exactly the opposite as in the developed countries. People are more focused on the science and the medical stuff and the medicines, and they forget about relationships. I think Portugal can have a great balance between those different realities. We are worried about the medicines and the more clinical things about the patients, but I would say for us it's even more important the relation we have between clinical team and patients. And it was one of the most important things I've learned with my experience abroad, is that being there, being present, care about the patients, not only about their symptoms and their clinical signs, it's the more important to care of them as a person, not as a patient. So I would say that I'm quite a practical person. I work mainly in palliative care and with elderly, so two different ways of end of life. I also have some ambulatory patients, more orthopedic situations, and this is my day-to-day work. I start working in palliative care by a random case of life. So I was looking from my first job, and a colleague asked me if I could replace her during her holidays, and I said yes, of course. I did it for 3 weeks. It was okay. I didn't thought about that too much. 1 month later, she asked me again to replace her for another 2 weeks. I did it. It was okay as well. And after that, she said me she was going to quit the job, and she asked me if I would like to take it. And I said, of course I want to. And then things changed a little bit. I needed to start thinking about what I was doing and understanding exactly what those patients' needs are and what should I do for them. And then I decided I needed to study more, and that's why I decided to take a master. After 1 year of working in palliative care, I started a 2 years master. It was interesting, especially because I studied in another country. I'm Portuguese, I live in Lisbon, and I studied in London, and it was a whole experience. So from the theory of palliative care, I learned a lot with very good lectures, and it was very good from this way, but it was also good because it was an international master's, and I met people from everywhere in the world, every countries and continents, and it was a very rich experience because we shared a lot of our personal and professional experiences in our own countries. I think there is not a big difference between a rehab setting and a palliative setting, in a way that we are always looking for improve people's quality of life. It can be recuperation of some function that was lost, or it can be just an habilitation to this new stage. We are always looking for quality of life, and this is a common thing across all the physiotherapy settings. By the beginning, when I started working on palliative care, it was a bit challenging. I was not expecting that, at least that often. I knew that it was a possibility, but I didn't know that it should be the common course of illness. So I start learning how to deal with that and see it as a natural thing. So when we have a palliative patient that we know that is not responding to curative treatment, we should prepare patient and family to this loss of function. And even ourselves, we should see it as a normal thing. It's the way things go. And my role, and I think our all the clinicians that work in this setting role, is to always adapt the situations to the function and the skills that this person still had. Clinical professionals has too much checklist to fill in, and they are more worried about the checklist and the records and to save all the information than to take care of patients. And I think by the end of the day, this is also another weight on their back, because probably people think or feel they are not doing their job properly because of the checklist they need to fill. I remember the first lady that I get very attached to when she was first admitted to our inpatient setting. She was quite well for a palliative patient. She was very active and motivated for physio, and we worked a lot. She improved a little bit her gait and her activity in general, and we were both very happy. But then after, I don't know, maybe 1 or 2 months in the unit, she started getting worse and losing her ability, skills, strength. She was dying. And I was not expecting that she was such a quick progression. We used to work so much that I couldn't expect that. And I remember her last days, and I wanted to be close to her every day. I was not doing physio anymore. I was just standing there and being myself. And she died with me. We were together and when she gave her last breath, and it was very shocking for me. I remember that day. It was probably the first and the last time that I cry a lot after a patient's death. And I realized that on the one hand, it was important that I cried. It means that I have feelings, and I create an honest relationship with her. But on the other hand, I couldn't cry every death of my patients. So I start learning how to deal with that, and not looking for covers to hide my emotions, but start seeing these things like illness progression and death as normal in my setting. It is a very important thing in my professional life. Usually we have a weekly meeting where we talk about patients and the deaths that have happened last week. We talk about patients and sometimes about their families and how can we support them. We don't talk exactly about our personal experience and feelings, but we talk about patients. And sometimes we bring them to our conversations, even it was 1 year ago or more. We talk a lot about our patients that have died with us, and sometimes we talk with a sense of humor to try to make it a little bit lighter, but it's the way we deal with it. It's One good thing in my working life is that I'm not all the time in the same place with the same patients. So I move around and I work in different settings in the same day, which is an important thing for me. So I work with palliative and non-palliative patients. I work in an in setting, in a care home, sometimes in patients' homes. So it helps me, those moments where I'm moving from a place to the other, it helps me to relieve a little bit. At the same time, I think using other skills like sport, physical activity, some kind of meditation, it helps me a lot. Not in the way that I should think a lot about my working day, but in a way that I should get my mind empty, not think about anything, but I would say, my body assimilate all the experiences of the day, but keep my mind relaxed. Usually I do yoga twice a week, and it's my personal moment. I have 1 hour and a half each time that I have my physical activity. I work out a lot, but I have also this meditation complement and relaxation that helps me to relieve my physical tensions and some stress in my mind. It was the way I find out to relieve and to deal better with my life.